Hello everyone! Today I'm going to talk about Attention Deficit Hyperactivity Disorder. Also known as ADHD, Attention Deficit Hyperactivity Disorder is a brain disorder marked by a constant pattern of inattention and hyperactivity. According to the US Department of Education's National Resource Center, an estimated 129 million children worldwide are suffering from this condition. So, what are the symptoms of ADHD? Inattention is a very common one. Patients can wander off task, lack persistence, and have difficulty sustaining focus. Hyperactivity is another symptom. Here, the patient moves non-stop, including in situations where to do so is not appropriate, such as in a classroom. Excessive fidgeting, tapping, or talking can also occur. Adults with ADHD may be extremely restless and can exhaust other people with their constant activity. Impulsivity is another common problem. Patients can act hastily without first thinking about the consequences of their actions. A desire for immediate reward or the inability to delay gratification is also typical. In children, symptoms of ADHD can sometimes be mistaken for emotional or disciplinary problems. Adults with undiagnosed ADHD can exhibit poor academic performance, problems at work, or multiple failed relationships. Of all the various symptoms, frequent feelings of restlessness, inattention, and impulsivity are often the things that ADHD patients struggle most with. So, what causes ADHD? Well, a number of factors can contribute to it. Genetic factors are believed to play a role, as it has been shown that ADHD often occurs within families. However, this could simply be due to the fact that family members often share similar dietary habits and have the same exposure to environmental toxins as each other. Environmental toxins are suspected to play a role in ADHD, especially when exposure takes place during pregnancy, and they can definitely affect brain development. In small babies and young children, high levels of lead can severely damage nerve cells, for example. So, what are the conventional treatments for ADHD? Behavioral therapy is often used in ADHD treatment. This involves practical assistance, such as help in organizing tasks or completing schoolwork. Behavioral therapy teaches patients how to monitor their own behavior and to praise themselves for controlling emotions such as anger and impulsiveness. The most common treatments for ADHD involves the use of prescription drugs, such as Ritalin and Adderall. However, both of these have been linked to suicidal thoughts and personality changes. Ritalin is a central nervous system stimulant and is proven to cause serious side effects including nervousness, agitation, anxiety, insomnia, nausea, increased heart rate, high blood pressure, and even psychosis. Adderall is a legal amphetamine and it's highly addictive with prolonged use. Its side effects include tremors, hallucinations, muscle twitches, high blood pressure, fast or irregular heartbeats, personality changes, and extreme mood swings. The 2015 documentary movie Prescription Thugs provides shocking evidence regarding the dangers of drugs used for ADHD. Fortunately, there are safer natural options for treating ADHD. The best natural treatment approach involves excluding certain types of foods from the daily diet and taking a combination of supplementary micronutrients. The most important things for ADHD patients to exclude from their diets are sugar and gluten. Sugar is a massive problem because it can cause blood sugar spikes, which in ADHD patients can result in a loss of focus when blood sugar levels spike down. Patients of children with ADHD have reported improvements when placing them on a diet that excludes gluten, a group of proteins found in wheat and various grains. Celiac disease, a disorder in which eating gluten triggers an inflammatory immune response on the small intestines, is quite common in ADHD patients. In addition to excluding sugar and gluten, it is also helpful to avoid dairy products, artificial food colorings, food additives such as monosodium glutamate and hydrolyzed vegetable protein, nitrates, caffeine, and soy. Aspartame and other artificial sweeteners should also be avoided. Beware of environmental toxins and eat organic produce whenever you can. Perhaps most importantly of all, research has shown that there is a clear relationship between micronutrients and the development of ADHD. A lack of micronutrients is common in ADHD and is seen almost universally in autistic children. Several specific micronutrients are especially important. Omega-3 supplements are hugely beneficial to ADHD patients. These essential fatty acids are critical for brain function and serve as potent anti-inflammatories. Ensuring a sufficient supply of omega-3 fatty acids to the body has been shown to significantly reduce symptoms of ADHD and improve learning. Children with ADHD may also need extra B vitamins, especially vitamin B6, to help with the formation of serotonin, an important neurotransmitter. Research suggests that lower concentrations of vitamin B2, B6 and folate are associated with an ADHD diagnosis. Levels of vitamins B2 and B6 are also linked to symptom severity. Zinc, magnesium, and iron play important roles in relaxing the nervous system. A deficiency of any of these minerals may exacerbate symptoms of ADHD. Research shows that levels of these minerals are much lower in children suffering from the condition. ADHD is also closely connected to the digestive system. Taking a good quality probiotic on a daily basis will therefore help maintain intestinal health. Research has shown that probiotic supplementation early in life may reduce the risk of neuropsychiatric disorders later in childhood. Finally, vitamin D, the sunshine vitamin, is very helpful with ADHD. According to a 2018 study, vitamin D supplementation in children with ADHD may improve cognitive function. If you have any questions, please leave a comment under the video or write to us via our website. We'll be happy to do our best to help you. See you soon!